Okay, everybody, welcome back. My name is Dr. Thomas Hughes. This is Dr. Andrei Dokukin, and as promised, we're going to show you EEG for TMS. Dr. Andrei Dokukin, who is an expert in this subject matter, is going to walk us through the process and also the equipment that we're going to be using today. What is this?
Thank you, Thomas. So yes, this is an EEG cup. EEG stands for electroencephalography. Essentially, we're going to take a bunch of electrodes, which are these white guys. They're going to be connected into a black box right here. We're going to transmit this information into the computer, which is going to show us a bunch of signals from every single contact point on this device. So therefore we're going to be reading electrical activity of the brain from many regions of the brain, as you can see here. And we're going to summarize that data, and we are going to create a nice report with some explanations of any individual symptoms. And we're going to start recording those waveforms on this cup. We've been actually treating Dima for at least 10 sessions, yeah? I think 10 sessions. So this is a follow-up study.
Okay.
We want to compare it to the previous one. Now, for Dima's sake, we're not going to discuss anything here, any private information. We're not going to show anything in terms of diagnosis or any kind of clinical findings, but I just want you to have an idea of what we're going to be looking at. We're not interested in doing EEG to determine abnormalities, what the neurologist would be looking for. We are actually looking at the baseline brain activity, which is inherent to the brain. This EEG is better. It is better, okay? It is better, but we still have a little bit too much of delta wave activity that you can see in the pinkish here. In the pinkish. It's not what that means is that at rest, while he is awake, some of the activity consists with sleep wave activity, with the sleeping delta activity. So what does that mean clinically? A person does not sleep very well, and the delta waves superimpose on the regular alpha waves. But this is much better than before, okay? This is his 20-second EEG. You see how much delta he had back then? It was huge. It was almost red. It was dramatically worse. But you see how pink this is? It's almost red, and we can see dramatic difference. I'm pretty impressed. We're going to take this data, plug it into that beast, and we're going to deliver the pulses based on his real-time EEG. And this is what's so cool about it. This is why this is pretty incredible, in my opinion. So you see how the lines are flat. This is because this box is not attached to the brain.
Tap that again.
And if I can tap it, you see how sensitive, how incredibly sensitive this guy is?
Nice.
This is great. All of these lines are now picking up the signal from his brain. And it's pretty incredible because these are really nice signals. We don't need to adjust anything. You see how it says 10 hertz right here? So this is the regular TMS. It only delivers the treatment at a frequency of 10 hertz.
Okay.
Why this is dramatically different? Because this protocol, the brain tuning protocol, is going to deliver the treatment based on his EEG.
Okay.
It's not going to be 10. It's
Okay.
going to be whatever the EEG says. It could be 9.5, it could be 10.3, but it's going to be individualized to his brain activity. And that is the marvelous thing about it. Over the frontal lobes, in the middle of the frontal lobes. So this is different protocol. Listen to the sound of the discharge. Listen to the sound, Dr. Hughes, because this is going to be very different from your regular TMS. Listen to the sound. It's not regular.
I hear it.
It is not regular. It's irregular. This is the difference. It is irregular because your brain does not fire at 10 hertz. Voltage. And he can actually tell us how much of a difference sound. So therefore, his own brain activity is directing the treatment. So that's pretty cool. So the treatment is being delivered once every minute. It's a 5-second train, 1 train per minute. And there are going to be 30 trains. While being treated, his eyes need to be closed. Yep. Voila, and that's it.